the orthoPAC, hosted by Sam Dyer. Welcome to the orthoPAC, where we discuss up-to-date orthopedic topics for the busy clinician. I invite you to sit back and relax as I attempt to fill in the gaps between education, current events, and real-world practice.
Welcome back, listeners. My name's Chuck Dowell, filling in for Sam today as the guest host for this episode, Practical Approach to Nutrition and Adolescence. Dr. Hall is a primary care sports medicine specialist at Children's Hospital in Phoenix. Welcome to the episode, Dr. Hall.
Thanks for inviting me back.
I briefly wanted to just cover supplements. I know creatine, again, has been a supplement that's been around for quite a long time. We hear about all these athletes using it. It, started at, higher levels and it's now making its way down to high school and adolescent athletes. Can you just give us, just for our listeners, a brief recommendation regarding the dosage of creatine, why we use it, if there's a difference between male and female athletes regarding the use?
Yeah, I will say, I always like to mention that the AAP, American Academy of Pediatrics, does not recommend the use of creatine. I've done my own research, looked into it, and I really have no problems with young athletes using creatine at all. The data is very clear that there are very minimal, if no risks of using creatine in the proper dosing. I think the benefit here is that it does improve performance in certain situations. And so ideally, any supplement you need to make sure and you take it, it's safe. And so we want to make sure that your supplements are third-party tested. So that means that an independent lab has looked at it, and usually there's a little label on the bottle. So I always recommend that no matter what you're taking. And then understand the mechanism. And the mechanism of creatine is that it helps to elevate the creatine phosphate system, and that system is more a quick burst system. So basically, when you perform an activity, you use ATP, and then ADP is left over. And then what will happen is when you have enough creatine phosphate on board, that phosphate group will get added to the ADP and make more ATP to allow you to have more energy at the muscular level. There is clear evidence that this does help in performance, particularly in the weight room, improving 1-rep maxes, improving strength training outcomes with creatine. There is some newer data that says that it can improve some cardiovascular metrics, and there is some thought that it can improve some mental focus aspects as well. And so I think it does have a significant benefit. The usual dose is 5 grams per day. There is a thought that you could do a loading dose of 20 grams for 5 days, but generally people don't do that as much. And so I've found that just doing the scoop that's labeled on the bottle, I don't really want people to do what's called dry scooping. So a lot of kids now want to just dump the scoop into their mouth instead of mixing it into water, and that should not be done. But there is a pretty good benefit to using creatine. I usually will have, suggest that in my high school athletes. And I don't think that there's a real big issue with timing. So yes, if you could do it couple hours before your activity, that would be great. But if you have to take it in the morning because it's just at your house and your practice isn't until afterwards, I think that's totally fine. I don't know of any data that's specific between male and female. I think it just being a metabolic issue in terms of how it works. I don't know that there's any big male to female difference, but I do think that it's not just for people lifting weights and can be used by really any athlete that's looking for a small advantage. But the one thing I will mention is always remember that these supplements, if they help you lift weights or they help you do a certain activity better, does that particular activity translate to your sport? So I always give the example, if you're improving your 1-rep max in a bench press, does that help you shoot free throws better? And if it doesn't, then you need to think about, is the purpose of this at the end of the day to help me perform better? And if I'm not performing better, then should I really be taking it? So I think that's an important concept when you're looking at different supplements. But I do think creatine is safe and appropriate for high school athletes if they're looking for a certain outcome.
Yeah. No, that's excellent. I think I've read some loose literature regarding female athletes and the use of creatine, but I think it's age dependent. In our adolescent group, I don't think there's any difference, as you said. I think as the female athletes get older, creatine's maybe used in a little different ways and can be kind of help with hormonal imbalance type issues in some postmenopausal people. But again, that's unrelated to this topic. But no, that's excellent. I really appreciate you coming on and discussing this with us. I guess just as a general kind of, what can you tell our listeners as an approach to seeing somebody, an adolescent that comes in and or giving recommendations to an adolescent? What's the first thing that we can start with as how to change and or how to make improvements as far as their athletic performance? Would you just say increasing calories or appropriate timing as far as fuel sources?
I think if I was in clinic and someone just kind of basically asked me, hey, like he wants to get better, she wants to get better at some of these things, I would just tell them like, hey, first thing you got to do is just make a plan. Go through, look at your daily schedule, like when do you eat and what do you eat? And then that way you can kind of do a little bit of math and saying, well, look, it looks like you really don't take in enough to really get the goals that you specifically have. I think if an athlete tells you, hey, I feel like I get fatigued throughout practice, then that's kind of a tip off. Okay, you're probably not fueling enough on the front end. And that's where I would recommend some of the chews and pretzels and bananas like throughout school or after school, if that may be the case. Or if, like the example we talked about, a tournament where you're an AAU person or a volleyball tournament, and they're saying, hey, we were trying to improve our nutrition on those days. I think that's a pretty obvious one, that it's going to be, look, we need to make sure that you have a fuel source on a regular basis throughout the day will probably be kind of your biggest bang for your buck. I think that's probably the best advice I could give generically, is making a plan, looking at your strategy, and then having the things available. So if you know what to do, but when you get to the tournament, all they have is nachos and hot dogs, then that's probably not going to be advantageous. And making sure you kind of have a game plan going in to execute on what it is you want to execute.
Excellent. Yeah, I think that's a great first step. Obviously, then you can go in depth and do, macronutrients and calorie counting and, use apps and things like that. But that's a great first recommendation for anybody just generally coming into, to clinic and wanting nutrition to help their performance. So I really appreciate you coming on today. I really enjoyed talking to you, and I think I'd recommend the listeners definitely go listen to your presentation.
Yeah, thanks for having me. I think this definitely, as you mentioned, is a topic that you could probably do, a 2-3 hour podcast on. So I appreciate the fact that we want to be precise, but I think that the talk does go a little bit more into detail. And there's lots more to this if people are interested. It's a cool topic, and it kind of sets you apart if you're able to speak on this for your patients.
Definitely.
Thank you for joining the orthoPAC podcast. We also welcome you to visit our website, paos.org, where members can download virtual conference content and get Category 1 CME. Also, if you're a non-member, please visit the aapa.org Learning Central for the PAOS virtual content.